Welcome to Lux Scout Psychology. Have you ever encountered someone who seems completely self-absorbed? Someone who demands constant admiration and seems indifferent to the feelings of others? You might have encountered someone with Narcissistic Personality Disorder, or NPD. NPD is a complex mental health condition characterized by grandiosity, a need for admiration, and a lack of empathy. Narcissistic personality disorder is often misunderstood, dismissed as mere vanity or self-centeredness. However, it is crucial to recognize that NPD is a serious mental health condition with far-reaching consequences. Understanding NPD is essential for protecting ourselves and setting healthy boundaries in our relationships. By recognizing the signs and patterns of NPD, we can make informed decisions about our interactions with individuals who exhibit these traits. One of the most prominent characteristics of narcissistic personality disorder is grandiosity, an inflated sense of self-importance. Individuals with NPD often have an exaggerated view of their talents, abilities, and accomplishments, believing they are unique and deserving of special treatment. This inflated self-image often serves as a defense mechanism, masking deep-seated insecurities and a fragile sense of self-worth. The need for admiration is a hallmark of narcissistic personality disorder. Individuals with NPD crave constant validation and recognition from others, often going to great lengths to secure it. Their relationships often revolve around their need for admiration, choosing partners and friends who will constantly stroke their ego and provide unwavering validation. One of the most challenging aspects of narcissistic personality disorder is the lack of empathy, the ability to understand and share the feelings of others. Individuals with NPD often struggle to recognize or acknowledge the emotions and perspectives of those around them. This lack of empathy can make it difficult for them to form genuine reciprocal relationships. What causes narcissistic personality disorder? It's a complex interplay of nature and nurture, involving genetic predispositions, early childhood experiences, and societal influences. Research suggests that a combination of genetic vulnerability and adverse childhood experiences may increase the likelihood of developing the disorder. These experiences might include childhood trauma, neglect, or inconsistent parenting styles. Early childhood is a critical period for personality development. In the context of NPD, certain childhood experiences such as excessive pampering or extreme criticism play a significant role in shaping the narcissistic personality. These experiences can lead to an inflated sense of self-importance or a deep sense of inadequacy and insecurity. Societal influences can act as a reinforcing mirror, reflecting and amplifying narcissistic tendencies. Social media, in particular, has created a platform for self-promotion, where individuals can curate their online personas to project an image of perfection and garner admiration. While societal influences alone do not cause NPD, they can create an environment where narcissistic traits are accepted and often rewarded. Diagnosing narcissistic personality disorder can be a complex and delicate process. Individuals with NPD rarely seek help on their own, often viewing themselves as superior and blaming others for any difficulties they encounter. Clinicians rely on a multifaceted approach, including a thorough psychiatric history and specific criteria outlined in the DSM-5. One of the most significant challenges in diagnosing NPD lies in the individual's often limited self-awareness. The very nature of the disorder involves a distorted self-perception, making it difficult to recognize flaws or problematic behaviors. Clinicians must navigate these defenses with sensitivity and skill, creating a safe and non-judgmental space for exploration. It's not uncommon for individuals with NPD to resist the idea of seeking professional help. Their deeply ingrained belief in their own superiority can make it difficult to acknowledge the need for change or to accept guidance from others, even trained professionals. This resistance can manifest in various ways. Some individuals may refuse outright to attend therapy sessions, dismissing the concerns of loved ones as unfounded or exaggerated. Others may attend sessions but remain guarded and dismissive, minimizing their struggles or deflecting responsibility for their actions. In these situations, it's crucial for loved ones to remember that they cannot force someone with NPD into treatment. Ultimately, the decision to engage in therapy must come from the individual themselves. However, there are ways to encourage help-seeking behaviors without resorting to coercion or ultimatums. Expressing concern in a non-judgmental and empathetic manner can be more effective than direct confrontation. Focusing on specific behaviors and their impact on the relationship, rather than labeling the individual as narcissistic, can also reduce defensiveness. While directly challenging the grandiose self-image of someone with NPD is often counterproductive, validation can be a powerful tool for engagement. This doesn't mean agreeing with their distorted perceptions, but rather acknowledging their feelings and experiences as valid, even if their interpretation of events differs from reality. For example, instead of arguing about whether their accomplishments are truly exceptional, a loved one might say, "I understand that your work is very important to you, and I can see how proud you are of your achievements." This validation can create an opening for a more productive conversation about the impact their behavior has on others. Gentle encouragement can also go a long way. Suggesting therapy as a way to improve communication, manage stress, or strengthen relationships may be more palatable than framing it as a means to fix a personality disorder. Highlighting the therapist's expertise in a particular area of concern, such as relationship issues or work-related stress, can also make therapy seem less threatening. Psychotherapy stands as the cornerstone of treatment for narcissistic personality disorder. This approach aims to manage symptoms and delve into the psychological underpinnings of the disorder. Cognitive behavioral therapy focuses on altering destructive thought patterns and behaviors. It encourages challenging beliefs about superiority and entitlement. Psychodynamic therapy explores unconscious motives and early childhood experiences. Patients uncover the origins of their narcissistic behaviors, often stemming from deep-seated fears. This understanding can lead to profound changes in personality and relationships. Group therapy allows individuals to interact and receive feedback on their behavior. Witnessing others' progress can motivate patients to engage more deeply in their own treatment. The effectiveness of psychotherapy hinges on the therapist's skill and the patient's willingness to participate. While no medication is approved for NPD, pharmacological interventions help with co-occurring conditions. Depression and anxiety can worsen NPD symptoms. Medications like antidepressants or mood stabilizers provide relief. Healthcare professionals must carefully consider medication use. Monitoring effects is essential due to complex reactions. Integrating medication with psychotherapy ensures comprehensive care. Engaging individuals with narcissistic personality disorder in treatment presents a significant challenge. Their inflated self-view and sensitivity to criticism often lead to resistance towards therapeutic interventions. Convincing someone who feels superior that they need therapy requires tact and patience. Initial focus may be on issues the patient identifies, like unhappiness or relationship difficulties. Over time, as trust builds, therapy can address deeper narcissistic traits. Stigma can exacerbate reluctance to seek help. Communicating that seeking help is a step towards self-improvement is crucial. Success relies on establishing rapport based on respect and understanding. The prognosis for individuals with narcissistic personality disorder, NPD, is not straightforward. It's a journey with twists and turns, influenced by many factors. Willingness to acknowledge the disorder and engage in treatment is crucial. Confronting ingrained patterns and committing to therapy increases the chance of positive change. Progress in NPD treatment is rarely linear. There may be growth and setbacks. Change takes time, patience, and commitment. Celebrate small victories. Each step forward shows courage and resilience. Recovery from narcissistic personality disorder is rarely a destination, but rather an ongoing process. Even with significant progress, individuals with NPD may benefit from long-term therapy and support to maintain their gains and navigate the inevitable challenges that life throws their way. Therapy can provide a safe and structured environment to process experiences, address interpersonal conflicts, and develop healthier coping mechanisms. Ongoing therapy can also help individuals with NPD to identify and manage triggers that can lead to narcissistic behaviors. By understanding the situations, relationships, or emotional states that activate their vulnerabilities, they can develop strategies to prevent these triggers from derailing their progress. Support groups can also be invaluable resources, offering a sense of community and understanding that can be difficult to find elsewhere. Connecting with others who share similar experiences can reduce feelings of isolation and shame, fostering hope and motivation for continued growth. Lastly, family therapy can be beneficial, providing a space for loved ones to address the impact of NPD on their relationships and develop healthier communication patterns. It can also help family members to understand the disorder, challenge enabling behaviors, and set appropriate boundaries. While narcissistic personality disorder presents significant challenges, it's essential to remember that healing and growth are possible. With appropriate treatment, support, and a willingness to confront deeply ingrained patterns, individuals with NPD can experience significant improvements in their lives and relationships. Therapy can help individuals with NPD to develop greater self-awareness, empathy, and emotional regulation skills, essential ingredients for building healthier and more fulfilling relationships. As they begin to understand the impact of their behavior on others, they can start to make amends for past hurts and cultivate more compassionate and reciprocal connections. It's important to approach the journey of recovery with realistic expectations. Change takes time, and setbacks are a normal part of the process. However, with each step forward, individuals with NPD can move closer to living more authentic, meaningful, and connected lives. For loved ones of individuals with NPD, the path can be equally challenging. Setting healthy boundaries, prioritizing self-care, and seeking support for themselves are crucial for navigating the complexities of these relationships. Understanding narcissistic personality disorder is not about labeling or judging individuals. It's about shedding light on a complex mental health condition that impacts millions of lives. By increasing awareness, we can foster empathy, encourage help-seeking behaviors, and ultimately promote healing and healthier relationships. The journey of understanding NPD is an ongoing process, one that requires compassion, patience, and a willingness to challenge our own assumptions. As we learn more about this disorder, we not only gain insights into the human psyche, but also develop a deeper understanding of ourselves and the intricate tapestry of human relationships. Remember, knowledge is power, and understanding NPD is the first step towards creating a more compassionate and supportive world for those who live with this disorder and those who care about them. Throughout this exploration of narcissistic personality disorder, we've peeled back the layers of this complex condition, revealing the intricate interplay of grandiosity, need for admiration, and lack of empathy that defines it. We've delved into the genetic and environmental factors that contribute to its development, the challenges in diagnosis and treatment, and the impact NPD has on individuals, relationships, and society. But knowledge without action is like a seed unplanted. Understanding NPD is not merely an intellectual exercise, it's a call to action, a catalyst for change. Recognizing the signs of NPD is crucial, not to label or judge, but to protect ourselves and others from the emotional harm it can inflict. It empowers us to set healthy boundaries in our relationships, to approach interactions with greater awareness, and to seek support when needed. The impact of NPD extends far beyond the individual, sending ripples of pain and confusion through families, workplaces, and communities. By understanding this disorder, we become better equipped to respond to those affected by it, offering empathy, support, and guidance. We can challenge the stigma surrounding mental health, creating a space for open dialogue and compassion. NPD is challenging for those who live with it and those who care about them. But amidst the complexities, there is always hope. Treatment can lead to significant improvements, fostering self-awareness and healthier relationships. Seeking professional help is paramount. A qualified therapist can provide a safe space to explore these issues. Asking for help is a testament to your strength and commitment to growth. Please like the video and share it with others. It can help those who are suffering. Thank you for watching.